Hello, everybody. It's great to be with you today. It's a pleasure and privilege to be with Cindy Elliott today. Cindy is the head of the commercial industry team at ESRI, charged with leading their go-to-market strategies for the private sector. Cindy comes to ESRI about 3 or 4 years ago with a great deal of experience in the manufacturing and logistics space. So Cindy, it's great to be with you today. Welcome.
Well, thank you. Thank you. Glad to be here. So excited we got this opportunity.
Yeah, I am as well. So today we want to talk a little bit about kind of what ESRI does and, of course, how they've supported clients through this COVID-19 crisis recently. So maybe you could start out by just telling us a little bit about pre-COVID ESRI and what you've done to serve clients and how you support them.
Oh, yeah, of course. Well, ESRI was founded in 1969, and here in Redlands, California, we're just east of Los Angeles. It was founded by Jack and Laura Dangermond, both residents at the time here in Redlands, and they established what was then called the Environmental Sciences Research Institute, hence ESRI, or how we're more well known now as ESRI. And wanted, at that point in time of our world's history, wanted to form kind of a research institute focused on how to apply spatial science to help the world sustain and become a better place. And as a result, over the last 50 years, we've become a very robust technology provider that's helping agencies and companies across the globe. ESRI's technology is known most commonly as GIS, or a Geospatial Information System, and spatial science, because it's not just about the map, and navigating from point A to point B, but there's a famous expression that we like to use, which is everything happens somewhere. And understanding where something happens and the result of that incident or occurrence helps organizations, people, communities, and governments better understand why it happened, where is it likely to happen again, and what's going to happen next. And so it's much more than the map. It's what we refer to as the science of where, right? And although, despite this great history, we're not well known in the technology space, but we operate 170 offices in over 100 countries, serving more than 300,000 clients worldwide.
Wow.
It's ESRI's preference that we don't put ESRI in the spotlight. We put our clients and the great work that they're doing in the spotlight. So one thing that we'll talk about later is that COVID's really kind of helped, in some ways, catapult ESRI into the forefront, because you can't miss us in some ways. But we've grew up in the public sector is what I refer to, working with federal, state, local agencies across the globe, most notably in the defense and intel agencies, as well as the public health, law enforcement, and fire, really focused on public safety globally. Of course, we have strong ties with a lot of nonprofits, including the World Health Organization, CDC, National Geographic, and the Audubon Society. But in most recent years, we've worked more and more with private sector. We've actually been drawn into the private sector as a result of this work that they see happening across the globe. We work with oil and gas, utilities, manufacturing, retail, and logistics companies as well. Two very well-known brands that are in your backyard, both Walmart and J.B. Hunt.
Sure, terrific. That's great. So can you talk a little bit about how you support your clients' needs? Like, what is it exactly that you do for them? How do you add value?
And it's a wide range of capabilities and value, actually. And most and foremost, I think the company really is known for helping organizations respond to unknown situations that are happening. And the more that they're able to kind of be prepared ahead of time and understand, again, we're back to what's happening and where and what's caused it, how do we help prevent those types of significant crises in the future? And how can those organizations better respond in time? But when we shift and think more about private sector, what we really are focused on and where organizations get the most value from our solution is the best understanding they can have of their markets and their customers, and how customer behaviors and how markets are shifting, because now those happen somewhere, right? And now you're being able to better prepare your distribution network, your supply network, and your productions, your products and services, so that they're more aligned with where the markets are going, and you're not just responding kind of at a gut level of what everybody wants. We refer to it as hyper-local insights to what's happening. And then companies can make so much better decisions based on that.
Well, those are very key issues today, of course. And, our gut, or at least, my gut is a little large, but it used to work okay in the past. But certainly in this unpredictable COVID-19 environment, I don't think anyone's gut's working too well, right? So maybe you can talk a little bit about some of the activities that you've been in today, because it seems like the nature of the work that you do is of hyper importance today.
I would agree, and I feel very privileged, by the way, to be with ESRI during this time. Of course, like every organization, ESRI had to reset itself and move, to being remote but leave essential workforce in place. But what we're most known for right now is the Johns Hopkins COVID-19 dashboard, and being the ESRI in the dashboard that Johns Hopkins University and Medicine had been already curating and collecting the data of not only the cases, but starting to analyze the cases associated with the mortality rates and the recovery rates, and creating these cycles. We've all heard about curves, right? There's not one COVID curve. There is millions of COVID curves. In fact, we all carry our own COVID curve. The Johns Hopkins dashboard allowed all this data to be seen not only by our communities, so we could know, but to healthcare providers globally, World Health Organization, the HHS, so they could start to analyze this curve. And as we saw it, it went from just understanding the red dots on the map to now being able to predict where the surges are going to happen, what's the needs, where the ICU beds are needed, where are the ventilators needed. So it's really helped drive kind of the model in which this response can be provided.
That's terrific. Yeah. So, and this is kind of the $1 billion question, right? Because million is too small anymore. But so can you talk a little bit about kind of behind the curtain? What's underlying those statistics and those projections? Obviously, forecasting is a critically important topic and skill set that we teach and we talk about oftentimes in supply chain. But as everybody knows, one of the greatest challenges and weaknesses of forecasting is that we're historically looking to the past to try to predict the future. And in this case, the future doesn't really look much like the past at all. So, particularly given some of the challenges that we've faced, I know some of the work that I've been involved in terms of making projections has been based on factors like the amount of tests that are administered. And obviously then we create a factor for positive tests and so forth. But when we're in an environment where, testing capacity is so limited, that's a real handicap to folks that are, trying to make predictive models. So maybe you can talk a little bit about, what underlies those predictions and what you think can, be instrumental in making the best predictions.
Well, you're right. I mean, a big part of even what we're looking for now from the history of COVID, old, right? And really not enough of an indicator to influence our future prediction at this time. And because over the last few weeks, especially, the data has been able to get to a much new granularity, moving from a national view to a state view to a county, and we're on the cusp of being able to break down the analysis to a zip code level, which is a tremendous breakthrough in being able to do these models. Because at a zip code level now, or even at a county level, you're looking at the socio-demographics of a county, the whole populations, the kind of demographics of a community, the density of a community, and now being able to weight those factors in what we refer to as an index, that there's certain index that we know about surged and the hotspot areas and the clusters that say if this is a community that has a more aged population or more densely populated or requires more kind of services personnel, that's a higher likelihood of an outbreak. So being able to lay all these factors together, which are all location in nature, that helps drive these predictive models. And the models now are even allowing what I refer to as these levers or these dimmers that say, is this community now under a more severe social restriction? Then the model kind of curves the down and flattens it out. No, they're opening restrictions and you can turn the dimmer back up. And being able to have that dynamic kind of interaction with the data, so the models are being able to be fluctuated on real case scenarios and continue to model that out. Those are the types of things we're looking at.
Well, thanks for that. And I really appreciate that analogy of the dimmer switch. You know, I think one of the challenges that we face is that a lot of these ideas and concepts are promoted in the media, not so much as a dimmer, but as a light switch, like an on-off binary type of thing. People, you know, for 5 or 6 weeks now have been talking about the peak, and it kind of drives me up the wall, or drives me up the peak a little bit, because, you know, that kind of implies that this peak, it has a defined moment in time, like we have reached the peak and now it's, you know, going to start to diminish. And the reality is, I think you know, most of the models that you look at depict much more of a plateau. It's not a precipitous fall off in terms of cases, mortality, or the resources required from a PPE perspective. And when you couple that with the notion that you brought up earlier, that, you know, all of these curves are overlapping but different across the country, it creates a real challenge for how you manage resources, which is actually a great segue, right, into PPE and healthcare. And this is actually how you and I met, working on at the Healthcare Consortium at USC's Marshall School to, you know, attempt to inform resource planning for healthcare providers. So maybe you can talk a little bit about ESRI's, you know, role and some of the contributions that you see, you know, that you're able to make from the perspective of PPE and hospital resource planning.
And I just want to say again, you know, a big part of ESRI's contribution is helping our partners and the organizations we work with run the actual kind of models and such. So my commentary will be much more about what I see others doing and how ESRI is kind of helping support and lead. But, you know, I really feel like no organization could have been prepared, right, for this crisis. And I think to myself that it's not as a result because any one institution or one agency or one manufacturer was doing anything wrong, right? It was a matter of the fact that this crisis in an unprecedented way spread across the globe. I hate the analogy, but literally like wildfire. Right. And as a result, when we used to have, and when you would you know, engage groups like FEMA, right, they were focused on a precise locale with a limited scope and time that they were trying to solve for. We're still in a spread moment, as you mentioned. You know, we've hit the peak, but the peak's not going like this, it's flattening out, and every day, you know, our numbers are increasing both in cases and deaths. But what we're finding is that, you know, the model right now, the demand model coming out of the healthcare side of the equation that I've experienced, especially in the last few weeks, is that every institution in every county and every state, and then normalized up, are all providing their own kind of individual perspective on the medical equipment they need. And it's not centralized in the context and overlaid with the urgency of that moment in time, or in 10 days time or 2 weeks time.
That's right.
Where do the models predict next is going to be where this equipment's needed. So instead you have all of these thousands of constituents, you know, kind of demanding on their own without the context of a centralized system. And then you also have supply organizations, both traditional providers and manufacturers of health equipment, who have their established healthcare distribution networks. Now you have the non-traditional manufacturers, and there's a lot of them: automotive manufacturers, vacuum manufacturers, and even sport apparel manufacturers. The Fanatics group out of Pennsylvania, manufacturing gowns and masks. And they don't have a traditional healthcare supply network, so they're just kind of pushing it into the market. And so you see these two wildly different models trying to connect. And so
at the same time now, the much stronger introduction of international supply, you know, which is
right.
The hospitals have directly been involved in the past, is global sourcing.
Right. And so I think what we're finding out, as you mentioned, you know, we met through a consortium that's been brought together in collaboration with the University of Arkansas and USC and several other business schools and their supply chain experts coming together and saying, how can we help kind of draw these things together? And I'm excited on what we're working on. I refer to it as there's two pieces to it. One is use the predictions and the models to understand on a rolling 12-week period what are the assumed hospitalizations by kind of geography across the country, that everyone with this data-driven approach can say, yes, we appreciate that these 12 spots today or in the next week are where we need to have our resources. And at the same time, we're working with some great medical professionals for helping guide us to say, you know, this is on an average hospitalization and the average patient, this is the type of equipment like the ventilators and the PAPRs and the PPE that are needed to care for that patient over their stay. And I think that bringing these two things together and getting the buy-in from our states and our national government are going to be just a great breakthrough in this. Yeah, no, for sure. That's terrific. Well, it's going to be an exciting period ahead, even as we, hit the plateau. So let's shift just a little bit and talk about how retail supply chains have responded during this crisis. Everyone's heard about two products, right, that they may have known about but not been all that interested in the past. And one is PPE. That's one that they may not have really thought of, but all of a sudden everybody knows what PPE means. The other that people have always known about, but maybe haven't given a lot of thought, of course, is toilet paper, right? And, right. It's all of a sudden been, a very popular topic, toilet paper. So how have you seen retail supply chains use some of the spatial analytics and GIS types of tools and thinking to respond during the crisis? I want to go back to say, again, this is an unprecedented disruption in supply chain. And I could share many, many, many examples of organizations that were more ill-prepared than others. But one spotlight for me, and there's a great article about their entire preparation for this, is an organization called HEB. It's a grocery chain out of Texas, based in Texas, but they serve, kind of the greater states around Texas, and based out of Houston area. So they source their products across the globe. And what they really established, I would say, as early as 2005, following the H5N1, issue and crisis, they established an influenza and pandemic task force. And so early in January, they immediately started having daily calls with China and their suppliers there. And then over the next weeks, as we saw, they started establishing that same daily cadence with their European partners and providers as well. And they did this for two reasons, not just to understand what was going to be disrupting their supply chain, but they started looking at what was happening in those communities and how was the customer demands in those areas shifting as you move people into lockdown or stay-at-home practices, and how did they need to immediately start shifting their supply model based on to their community based on what they were seeing in that shift. And essential to their responsiveness is that they have an emergency operations center out of San Antonio. In San Antonio, they have a wall-to-wall common operating picture we call live operating picture, available in the article, which was, by the way, it's called Inside the Story of How HEB Planned for the Pandemic. And all their real-time spatial analysis, and they've overlaid in a map not only the store locations, but the concentrations of their customer communities and spread of the virus, the spread and the state of social restrictions by community, by neighborhood. So they could immediately start to understand that impact. So they know that as a first responder, they need to provide the services and support to their communities as much as they can and as quickly as they can. And a key aspect of this is, in addition to responding to customer demand, they also were able to see that there were other vendors that they normally didn't work with. One in particular was a prepared food distributor who no longer was being able to serve schools and restaurants. Started to bring those needed goods into the store directly, so it kept the food distributor intact, and they were able to find a new channel very quickly through HEB to serve their community. So I thought that was a really great example of not only being prepared for the pandemic ahead of time to their best ability, but adapt to how things are changing. And we're going to still be in that they're going to be changing constantly for quite a while. Sure. second example I'd like to share that is not retail related, but more of a manufacturer. And it's a large manufacturer here in the United States that produces and installs and services like health and sanitation, health and sterilization products. And think about the air purifiers in our hospitals, in our school systems and restaurants, the hand sanitizing stations that you see almost everywhere you go, even more so now.
Yeah.
Their model was, healthcare, restaurants, education, and sporting events and hospitality, and immediately disrupted. Their business is increasing in some areas and the need to serve. At the same time, other businesses are declining. And it's about, yes, I need to go serve the hospital and not the restaurant, but do I have the workforce that I need? Do I have the equipment that I need? Do I have the supplies I need in the right locations to serve the customer at the right time? Again, all location based, and they're using the analysis on kind of the allocation of the resources. But as conditions change, a business that was open yesterday might be closed today. We think about some of the food producing plants, right, or the meat producing plants. How do you I refer to it as immediately reflect that change in your process, and using spatial analysis, they're able to kind of normalize that kind of disruption to where it's not even visible anymore.
Wow, that's terrific. So, now we're really gearing up and planning for what many are referring to as a reopening. Again, that kind of implies this flipping the sign from closed to open. And, I think share the thinking that that's not really reflective of reality, or at least hopefully not going to be reflective of reality because of some of the risks associated with that type of approach, long-term and short-term. But can you talk about, how you and some of your clients are thinking about this next phase as we start to move back towards, activating or reactivating the economy?
I've heard a couple of great expressions that I'll try and give credit due. U.S. Labor Secretary Scalia said, we're not going to have a rebound, we're going to have a climb, right? And then what was currently, what was before COVID won't look like that anymore. It's not going to be this mirrored recovery. It's going to be this other combination of things. And also, I think about the more and more we talk to organizations that we work with, they're already thinking to themselves, we're not going to recover the same way that we kind of went home. And what they're saying is that even if the government, the governor or the county and the mayor say it's fine, we're going to reopen business, a lot of organizations are going to make the decisions on their own about how they're going to engage and reestablish their business. And it goes back again, even small business to large, every place where they were conducting business before is a new unknown. And they have to say, based on those social, economic demographics, based on the policies and the restrictions in those markets, they may not want to go back into market. They may have to reopen and reclose again and be very adept and agile and able to do that without real expensive and costly missteps. And so I think the way that we're seeing organizations take a view is that they're not trying to reopen a state or their business within a state or within a nation. They're really looking at a new level of hyperlocal analysis and taking in all those considerations because they've either furloughed or laid employees off. Their traditional networks are kind of in hiatus related to supply and delivery. And so they're going to just want to understand, where is my best next business to be activated, and go and activate that and get it stable before they move to the next. So it's a whole different perspective, as you mentioned. It's not a light switch and it's not everything returning back to the same as before. It'll be very graduated and very precise.
Well, and I appreciate that. And also in our previous conversations, we've shared the idea that it's also not a unidirectional type of progression, right? I mean, leading companies and thought leaders, we're expecting a lot of ebb and flow. Back to your dimmer switch analogy, the ability to more or less turn up or turn down supply and capacity, right, to meet demand in various regions and locations across the country. You made an interesting kind of comment earlier that made me, it struck me because I've been thinking a lot about this whole idea of many people kind of subscribing to the idea that, oh, supply chains have really failed miserably. Supply chain designs have been inappropriate. You hear a lot of folks, expressing a lot of concerns about, like, for example, lean supply chain designs and so forth. And I have some thoughts on that. I personally do not feel that, everything we've learned about supply chain over the last 20 years has been wrong. I also don't believe that lean supply chains are dead if you really understand what lean supply chains are. In terms of their ability to understand the customer and respond to the customer, that is all based on understanding, which of course is based on what you do, which is data. But maybe you can talk a little bit about your views on that. And I apologize if I've biased you, right? But what are your views on this whole idea of, lean in supply chains and supply chains designs and what we've historically known about supply chains that have brought us to today?
I think that's a great perspective, David. Actually, I think that I agree with you that it's almost nails on a chalkboard when I hear the news that the whole crisis is predicated on the failure of the supply chain. And supply chains are driven by people and process and data. So I believe, the network and the infrastructure that's available to us today in our kind of modern world, we can apply all of those things, but when I think that's what is needed, will be shifting post-COVID, because where I've seen the failures occur is less in the actual infrastructure and kind of intelligence of supply chain, but it's who's directing what needs to be done. And I think that I'm hoping there's a gain of respect for the strength of what supply chain and the improvements that supply chain can bring to an organization or to a whole practice. But again, it all predicates back on who's directing. And I think that's my perspective, if that helps at all.
Yeah, no, I appreciate that. That's really interesting. Good stuff. And again, I think that, there's no better time than now to be in supply chain and no better time to be in your line of work, from the perspective of analytics and spatial analytics, GIS, and so forth. So what do you think about COVID-19, as we're kind of getting towards the end here of our time together? What do you think about COVID-19 as kind of like a watershed moment or a tipping point in terms of organizations, receptivity and adoption to the type of work that you all are involved in spatial analytics and GIS?
It is watershed. I like that expression a lot. As I mentioned before, it really has pushed the need to know about location and the science of where first and foremost, right? And I think that the watershed is the fact that it has been brought into the spotlight so much from a standpoint of, we all think spatially already. We think about our maps and how we get from point A to point B. And I think this moment in time, and it'll carry over, hopefully, is that we can also now understand how that relates to the other things that are happening where we are. And I think two things. It's one, it's like opening the mind of so many people now of the view of something spatially and location centric. And the other will be the ability at those hyper-local levels to drive analysis now beyond a gut feel or beyond a macro perspective, that organizations are going to, and leaders are going to be demanding that hyper-local analysis now. And I think that's going to be what kind of cracks the piñata open, right? And traditionally, it was good enough not to have such a precise view and precise insights, but that's not good enough anymore.
Yeah, great. Well said, well said. Well, now as we kind of come to a close, I want to play a little bit of a rapid fire game with you, or kind of like a parting shots type of game.
Okay.
In a past life, I was a professional bowler. You may have seen my retirement presser on SportsCenter. I was a SportsCenter fan, but I never got on SportsCenter, and I never got to do the sports reporters on Sunday morning when they do their parting shots. So this is going to be my attempt at parting with you. Okay, Cindy. So Cindy, Elliott, here are your parting shots. So what are the top 3 takeaways for healthcare supply chains coming out of this COVID-19 environment?
It's a centralized perspective, right? Knowing that everybody's operating independently, there has to be consensus on where the most urgent needs are. There has to be a normalized view of supply and where supply is coming from and whether it's certified or valid or not, and how do you bring that kind of supply to the most urgent demand. And I would say the big thing for me has been a shared collaboration environment. Everyone has very closed systems, and there needs to be more information and data sharing.
Boy, great. Well said. Well, thanks for that. Now let's shift a bit and in terms of parting shots here, what are your top 3 takeaways for retail supply chains coming out of the COVID-19 crisis?
I would say for sure. I mean, retail, we've seen the kind of success, we want to call that, of our grocery and our food services and our pharmacy retail. And I think their disruption has been very different. How to move from 80% in-store shopping and fulfillment to delivery curbside, and so shifting their models, right? And being adept and being able to respond to how that model is shifting day over day or week over week. I think that's the first thing for kind of that type of retail that hasn't completely been shut down during the crisis. And if we move over and we look at some of the other industries in clothing, apparel, beauty, and restaurant, they are going to come back into the marketplace, but I think we're going to see them come back in a different method, meaning that maybe they're downsizing their store footprints, they're leaving their fulfillment centers to do more just in time, and whether it's buy in store and fulfill at home. I think you'll see a shift in their fulfillment perspectives, because they're not going to want to bring those large store footprints all back online at the same time.
Great. Thanks for that. Appreciate it. And now, how about 3 parting shots for what spatial analytics and GIS means in the post-COVID-19 environment? What's the future look like?
I think, and I'll talk about private sector in particular, independent of retail, but between manufacturers and AEC and others, it will be the emergence and kind of standardization of that hyper-local analysis. Mm-hmm. Really understanding at a community level the demographics, the gaps, the vulnerabilities, and the opportunities, so that it's not one model for all. It's not that uniform model across the country. And I think you'll see a lot more focus on that. And then secondly, it would be being more confident in collaborating with partners up and down the ecosystem, that sharing and collaborating on process improvement and not staying siloed is going to be very important. And that's going to be a trust factor as much as it is a technology factor. And I think the third is going to be more and more awareness of customer shift, and where as a company, any organization, really understanding the seamless customer experience or customer awareness, and not kind of pocketing things and like, oh, they're a digital or a in-store experience or a kind of online fulfillment. So I feel like there's this understanding customers holistically and not based on their category will be really big.
Thanks. Those are great thoughts. I really appreciate that. One other item came to mind, and that is this whole idea of what we were calling before COVID-19 is omni-channel, right? I mean, I've been teaching omni-channel ideas for 3 or 4 years now. It's been hot and sexy, and it occurred to me as you were talking about essentially utilizing different channels of distribution in a just-in-time way, that boy, this environment has enormous implications for omni-channel moving forward. Do you have any thoughts on omni-channel, GIS, spatial analytics, and post-COVID-19?
Yeah, so that's a lot to consider, but absolutely. I don't know about you, but the acceptance of so many more populations and stakeholders and constituents moving to online engagement. And I think what I believe, because I'm probably evident of this, is that I still may want to pick up in store or have curbside delivery or have delivery at home. But every day my decisions might fluctuate based on where I'm at in my current state and time. And whether it's B2C or B2B, I think you're going to see that same need again to create that kind of omni-channel or holistic experience for customers as a whole. So I think this has prompted the customer, the users, to be comfortable with that omni-channel experience and going digital. And so I think you're going to see an adoption or a demand for it that we haven't seen before.
Well, thanks so much. Really appreciate your time today and the treasure of insights that you shared. I mean, what a fantastic discussion, conversation. Really appreciate your thoughts on kind of where things are heading. Anything else you'd like to share before we sign off today?
No, I think it's a pleasure. I look forward to being able to meet you sometime in person and being able to continue on our projects and our ambitions, because I think in addition to what we were talking about, COVID and these things, this is going to be the moment in time that supply chain innovation is going to just explode in a good way. And I see the University of Arkansas and the program you're running to be forefront in that innovation. So look forward to it.
Well, thanks for that. We're very fortunate, very blessed in this Northwest Arkansas region to really kind of be living in the hub of supply chain. My personal bias is that there's no better place on the planet to study supply chain than Northwest Arkansas. But I might be biased, right?
Yeah.
Well, thanks for your time today, Cindy Elliott, the head of customer industry team at ESRI. We appreciate your time, appreciate your thoughts today.
I appreciate it, David. Thank you so much.
All right, thank you. Take care, Cindy.
Thank you.